Hey everyone, so today we're going to be going over your functional brace fitting. So making sure that once you have the brace for your patient, your measurements are all correct, and we have the brace, that we can make sure that it fits the patient and go over education and make sure that they know how to fit it themselves. So what we're going to do is we're going to start off with our patient sitting in a seat just like this, close to the edge of the chair. We're going to have their foot planted on the ground, and when we put the brace on, the knee is going to be at about 30 to 45 degrees of flexion. So in order to get the brace ready to put on the leg, you can see this is how it will come out of the box. All the straps are intact, so we're going to go ahead and open the brace up, starting at the bottom with the number 1 strap, pull it out of the D-ring, and then fold it back onto itself. This way the Velcro is not sticking to each other, and it'll be easy to apply the brace. Next, we'll do the number 4 strap in front. We'll pull it out of the D-ring on the side, but we want to make sure that we leave the strap in this loop on the anti-migration band. So we'll pull out here and just make sure that we do not pull the strap out of this loop. So we'll leave it through the loop, and you can Velcro right over the top. Next thing you can do is open up your anti-migration band, like so. Move to the back to the number 2 strap. And to the number 3 strap. And then we can loosen the number 5 strap back here, just to give it a little more wiggle room. But we do not have to fully pull out number 5. So the brace is all opened up, ready to go. So you're going to have your patient lift their foot up and step directly through the frame and plant their foot back down on the ground. Again, you can see knee flexion about 30 to 45 degrees, which is perfect right there. What we're going to do is bring the brace up the back side of the leg, and then when we get to the thinner part of the knee here, we'll bring the hinges forward and rotate them up into place. Now what we're looking for here is we want to find the patella, the kneecap. You can see it's right in this location here. You can see the boundaries, top, side, and bottom right here. What we want to do is find the top crest of the patella, and that landmark you want to line up halfway through your hinges. So what I like to do is take the side of my finger, find the top crest of the patella, and then draw a line straight across the knee. And you can see that line is a little bit high on the hinges here. So we're going to bring the brace up just slightly and then double check there. You can see we're right about through the middle of the hinge, or what I like to tell patients, the top crest of the patella goes through the end of DonJoy on the side of the hinge. That's how we know that we're high enough up on the leg. Next thing we want to do is make sure that we're nice and flush on the sides of the leg. So you don't want the hinges too far forward like this with gaps in the front. You don't want them too far back so it's falling off the back of the leg. We want it right down the midline of the leg so we're nice and flush on both sides. So the brace is lined up in the correct spot now. So what we can do is start strapping it up. So we'll pull out the anti-migration band and we'll go to line up the brace. But one thing you notice on here, see the thigh calf sits nice and flush, but the calf cuff is a little bit too tight, so it's not sitting flush on the patient's leg. So what we can do on braces such as the FullFORCE that have a malleable frame is we can pull the brace off the leg and have the patient step up, and you can actually grab hold onto the frame itself and use a little bit of force to pry it open. That will give us some more width for the brace to fit around the leg. We can go ahead and try again. And we'll get the brace lined up one more time. Double check. Top of the patella halfway through the hinges. Hinges are nice and flush on the sides of the leg. Thigh cuff sits flush on the thigh. And now you can see the calf cuff sits nice and flush on the side of the calf. So now we can start strapping up the brace. Again, you can see that each strap has a number on the front, which will be the order that we go in when strapping up the brace. Number 1 is at the bottom. However, what we're going to do is start with the anti-migration band inside. This is not numbered, but I like to call it number 0 because this is where we're going to start each time. So we want to bring it across the front of the shin after we make sure it's nice and flush on the leg. And we will tighten the 2 halves together like so and make sure it's snug on the shin. In order to double check this, what you can do is use a finger. If you can slide a finger in between the anti-migration band and the top of the shin, that means it is too loose. For example, if it was like this, I can slide my finger in, it's too loose, so we need to retighten the anti-migration band and double check, and we're good to go there. So we start here at number 0. Next thing we're going to do is number 1 down at the bottom of the leg. So we'll bring it through the D-ring. What I like to do is push on the back of the calf frame to make sure it's nice and snug on the calf, and then tighten the strap across the front. You can see here we have a little bit of extra strap hanging off the back side, so we can actually shorten up this strap to make sure it fits the leg well. So we'll pull it out of the D-ring. We can remove the padding on the back, and right here we can open up the strap and pull it a little tighter, which will shorten it up on the back side. And then you can place your strap right in the back on the front of the knee and bring your strap into place here. Go through the D-ring one more time and make sure it's nice and snug on the shin. Number 1's good to go, so then we'll go to number 2. Number 2 is located at the top of the brace here. So I'll open it up. And sometimes I do recommend that the patient does this one themselves because it is a little bit higher up on the thigh, so you do want to respect their personal space. So the patient go ahead and take the strap and pull it around the back side of the thigh. Make sure the pads are nice and flush, and then through the D-ring. This strap we do not want to be overly tight, so we'll just pull it until it's nice and snug. You can push on the top of the thigh frame as well, and then just lightly snug it down and tighten the Velcro. So number 2 is good to go there. Now we have number 3, which is a little bit lower on the back side of the leg. Again, we'll go around the back, pull out the D-ring, and before you tighten down number 3, you want to make sure that your hinges are still in the same location so that they're nicely seated on the sides of the leg. Number 3 strap will help prevent them from sliding forward on the leg. So we'll go ahead and make sure that's in the correct spot, and then tighten down and attach your Velcro. Next one is going to be your number 4 strap in the front. This strap is very crucial to make sure that the brace stays in the correct position, as it will help prevent with migration as well. So we'll bring number 4 through the D-ring, and this one we can tighten down relatively snug. One thing to note when you are doing the straps, you can see if I just pull here, it may pull the frame and the brace out of position. So in order to prevent the brace rotating, I do like to stabilize on the frame itself and then pull through and tighten down the strap. That one is good to go. And then the last one is number 5, which is on the very back. Again, this is the ACL strapping sequence, so we only have straps 1 through 5, plus the anti-migration band. What we want to do is just make sure that number 5 is nice and snug. So we'll pull it snug and then tighten it across. And what I like to tell patients is once number 5 is set, you set it and forget it. So you only have to tighten it down the one time, and then we do not touch number 5 again. So now the brace is in the correct position and the patient is ready to wear it. So once the patient is done wearing the brace and they are ready to remove it, they can remove the straps in any order that they would like. But I always just recommend going in a reverse order of how the brace was put on. So again, we do not touch number 5 now that it has been set. So we will start with number 4 here. Go ahead and undo the strap, pull it out of the D-ring, again remembering to leave it through the strap on the anti-migration band and Velcro back onto itself there. And then we can go to number 3 on the back side. Release and fold back. And you can do number 2 strap up top. And then we will come to number 1 down at the bottom. And lastly, the anti-migration band. It's all loosened up. Now the patient can go ahead and step right out. And the brace is ready to be put on the next time.